let's start there. What are stem cells?
So it's sort of a potent cell that's a naive cell that can help the body heal and regenerate.
What are the biggest negative impactors of stem cells?
You'd probably have to think of feeding it consistent processed carbs, things that are genetically modified.
And trauma, like these mental emotional things. Is there any studies to show its direct impact on stem cells?
It has to have an impact because it changes the autonomic system.
What are your thoughts on fasting specifically and its impact on stem cells? Do you think it's an effective way to naturally enhance them?
Based on the science.
Dr. Gonzalez, welcome to the podcast.
Thank you very much for having me. Pleasure, honor to speak with you and to educate, which is something that I love to do.
Yeah, same here. This is something that we've never talked about in depth on the podcast. So today's going to be the day of all these therapies that I find the science so exciting, so unique. But can we kind of start with what's your background? Like what got you in the space that you're in now?
Yeah, so my PhD is from University of California, Irvine, where I was part of the group that studied the interactions of the immune system in spinal cord injury and stem cells. So those that hear, like back in 2000, the Christopher Reeve Paralysis Foundation and stem cells were probably one of the first, studies that actually put sort of stem cells on the map in spinal cord injury. I was part of that group, fell in love with the concept of, being a scientist, of from bench to bedside, developing things that can be applicable relatively quickly and soon, and then just fully envelop myself into stem cell therapies and cell therapies in general, because we do several different types of cell therapies in our company.
Great. Okay, so how do people see you? Did they go to you to a physical location, and if so, where is that at?
No, they don't. I'm a scientist, so I'm not a clinical doctor. I'm sort of the guy in the background that at this juncture talk to many patients, as you would know, that have a lot of things going on. Since I understand biology in depth, cell therapy in depth, and if you look at the cell, it's a basic functional unit of life. If one thing goes wrong with it, everything goes wrong. It's havoc. There's so many things going on. I'm sort of like people come to me, a lot of doctors come to me to help them troubleshoot very difficult cases. My focus has been in the context of immunology and the immune system. And there's so much going on nowadays, as you know, with, autoimmune disease on the rise, the viruses causing worse havoc to the immune system, people having an exhausted immune system, simultaneously having an overactive immune system. We're sort of in crazy health times, and then and then everything else that's going on with toxicities of food, environment, etc.
Yeah, for sure. All right, so let's define some things. Stem cells. People have heard of stem cells, but maybe are kind of uncertain about what it is exactly. So let's start there. What are stem cells?
It's basically a cell that can basically, in theory, it was thought that it can change into any other cell type that's needed in the body, and it can do that. But now with cell therapies that you hear, that's not what transpires really. So it's sort of a potent cell that's a naive cell that can help the body heal and regenerate. That's the most important aspect of it, help heal and regenerate. But it actually does it, we now know, through different types of signaling cues, communication skills, that one cell has to communicate with another cell. And that's what this cell does. If you think of every cell in the body communicates with another cell. Otherwise, you'll never be in homeostasis. You will never feel fantastic because it's got to be a consistent communication with one cell from another cell. There's many different examples of it. I mean, if you think of hormones, that little nanovesicle that communicates all the way from the pituitary all the way down in the man to the testes to produce testosterone it's really interesting. How does this transpire in the body? And every cell in the body does this, but stem cells do it in the context of how do I heal, how do I fix an issue, and how do I help my neighboring cells survive and do what they need to do to keep us in that balance, homeostasis.
Got it. So where do stem cells, where are they made in the body endogenously?
So there's different stages of it, of course. If you can think of, you can isolate stem cells from an embryo, you can isolate stem cells from fetal tissue, and then you can isolate stem cells from us. From us means anything post-birth. which consists of the time frame of once a baby's born, an umbilical cord, which is tissue, the umbilical cord blood, which is a different type of stem cell that many have heard of or use in the context of cancer to help put people in remission. Then there's the placenta, then there's the amnion, and then as adults, as adults, you can isolate them from, which is very far and few, teeth, bone marrow, and then fat. The problem is that as we age, they come with the same inherent issues that we have, just like every other cell in our body. And they're also aged because every single cell in the body has a finite amount of divisions, how many times they can divide out, and then they're aged or exhausted. They're as old as we are.
Got it. So as we age, I mean, and you mentioned sort of the modernity, that the time that we're living, the onslaught of epigenetic factors. Do you feel like our stem cells are being negatively impacted now more than ever before, or is it about the same and just a normal aging process?
They're worse is what we've been seeing with a lot of individuals, especially those that are not focused on the diet, the environment, the supplements, doing the right thing. The majority of us have our guts destroyed, unfortunately, or not absorbing things the correct way. The immune system is the majority of it's in the gut. They're worse. There's more and more problems progressing on a daily basis with, like what we talked about, viral burdens coming in and causing a bunch of havoc in the immune system.
Got it. So what are the biggest, you mentioned diet, and maybe we can narrow down specifically. What do you think at this point, from what we know from your research, what are the biggest negative impactors of the human stem cells?
You'd probably have to think of feeding it consistent processed carbs,
okay,
things that are genetically modified, these, sugars, anything that causes excessive proliferation. Because the body thrives on, C6H12O6, which is basically glucose, the formation of glucose on a consistent basis. The body wants it, but when we're consistently consuming these type of things, it forces cells to divide. It's a similar thing of, if you think of, the only evidence on longevity is basically caloric restriction. It's one of the key things that's already known, and all the centenarian studies have been shown that you maintain caloric restriction. And why, if you think about it, is the cell in the body has to do one thing: slow down division. Remember, you only have a finite amount of divisions. Then you've exhausted the body of how many cells, and you're done. You're expired. You're going to expire. So if you slow down cell division, which one thing is eliminating sugar, because cells love sugar, they'll consume it and they'll metabolize, and another cell is going to divide because of the amount of processing that has to happen, not only in the gut, but what people don't understand is the liver is where all metabolic function happens. And it forces cells to replicate a lot faster when you consume too much pizza, let's say, or whatever. And pizza's not bad. I love pizza. It's actually one of my favorite things. But it's when you consume a bad pizza, one that's made with really bad flour, carbs, whatever, it just taps the body to have to metabolize it and then forces cell division.
Got it. So are there any other environmental factors, maybe I'm thinking pollutants, anything else that the science shows is negatively impacting stem cells?
Yeah, absolutely, because anything that you think of, for instance, entirely too much exposure, to sun, let's just say, you burn your skin, you have mutations, your immune system has to do something to it to clear it if your immune system's healthy. Similarly can happen to stem cells. Stem cell has to find a way to replicate and produce these new cells. But if there's, mutations that can occur based on environments, for instance, here in California now, all these pollutants that are happening with all the fires, it's a negative impact on the single cells, the cells in your body, and possibly the stem cells too.
Got it. And I'm assuming, as with most things, but I'd love to know what you're finding with your research, the impact that stress and trauma, these mental emotional things. Is there any studies to show its direct impact on stem cells?
I haven't seen any per se that I can tell you about, but I can guarantee you that it has to have an impact because it changes the autonomic system significantly, and it changes the central nervous system significantly. And you have to remember, you have stem cells in your brain too, that you actually have on a regular basis. And if you're on overdrive consistently because of too much stimulants or because too much of flight or fight response, then there's going to be some issues with these cells replicating, trying to fix too much where they shouldn't be working on overdrive.
Mm-hmm. You mentioned caloric restriction as being one of the ways that science has shown like a very effective way at supporting stem cell health, right? I guess is a good way of putting it. Like what are your thoughts on fasting specifically and its impact on stem cells? Do you think it's an effective way to naturally enhance them?
Based on the science, yes. I'm just not the opponent of doing fasting too long for aging. I'm in the the longevity sector, and I have similar beliefs to our colleague Dr. Josh Axe in that aspect. As when you age, you're trying to as you age, you decrease muscle mass.
Mm-hmm.
And the last thing you want to do is decrease muscle mass because it causes frailty. At some juncture during fasting, whether it's 2 days in, 3 days in, you have to start basically disrupting muscle function, burning into muscle reserves to actually consume the nutrients that you actually need in the body to survive. That's the only thing. I'm 100% on board with 24-hour fast to cleanse the system. There's a significant amount of evidence that helps with autophagy, to remove all the senescence, which is another platform that we work with a lot, is senescence. And it helps stem cells thrive. There's evidence that, for instance, individuals that did in the context of cancer that did a 3-day fast, when they had a stem cell transplant, the cells integrated better.
Got it.
And quicker.
Got it.
So it's because the system's clean. You're putting basically something into a clean slate. And if you're eating crap and bad stuff, it's not a clean slate. The immune system's going to basically remove it, and it's going to be detrimental.
Got it. So to repeat back and kind of dial in this, you're a fan as far as the studies are showing. You think it's promising and a beneficial thing to do intermittent fasting, even 24-hour fasts, but like don't abuse it or don't be so aggressive when you start losing muscle, and that's going to be dependent on the person, right? And that's when you start seeing these sort of negative drawbacks if you're interested in longevity and the health span benefits of fasting.
Correct, 100%, yes.
Okay. So is there any specific type of time compressed feeding, time restrict feeding that you like the best? Do you do anything specifically yourself?
I do intermittent fasting myself. I sort of have not, but now it's sort of funny because I switched it because I started noticing that my sleep was affected. I was doing I would eat from 12 to 8 p.m. and then that's it. But then I started noticing, because I wake up so early, that my sleep was getting affected because I was eating too late, and my metabolic function registered. You can tell heart rate goes up a little bit. You're basically digesting food. I've now switched it to stopping eating at 6 p.m. Where it's better, but I normally start eating now at 10 a.m. instead, or something like that. I'm all about it. Every once in a while, even doing a 24-hour fast. I mean, if you think of what happens when you overeat, you feel sick, you can't consume anything else. When you feel like you have to vomit or you feel like super gas and bloated, it's your own body telling you, stop eating.
Mm-hmm.
I mean, you have to do something about it. There's a significant amount of benefits to the time restricted aspect of, eating within a specific time frame, cutting it down, because it somewhat forces you down, unless you gorge, to cut caloric intake. The only way you lose weight is it's a numbers game.
Mm-hmm.
Is you gotta cut calories, and you have to find the correct diet to do so.
Mm-hmm.
I'm not about any specific diet. Probably a lot of people are not. It just depends on the individual.
Mm-hmm.
If you do a vegetarian diet, if it helps you and it's good for you, knock yourself out. If you're a carnivore and it helps you and it does good for you, knock yourself out. I'd more flex in between. Like every once in a while, I'll go 2 or 3 days straight vegetables, and some days I'll go straight carnivore. Just recently, I just did a day, actually 2 days of straight carnivore, and then maybe I'll switch,
Mm-hmm.
into and I'll cut. And for me, like I said, I've been traveling a ton. It's a numbers game. I know I ate a lot of food on Tuesday. I just got to cut the following day.
Mm-hmm. So there's not, what I'm hearing is that you're kind of flexible as far as the research is concerned. Whole food, nutrient dense, bioindividuality with this, the art and science of it all. But from a nutrition standpoint and its connection to stem cells, there's not like vegans don't have an advantage to stem cells, or someone that's carnivore doesn't necessarily have an advantage to stem cells. At this point, according to the literature, that's not the case, correct?
Correct. And the only thing I have to say is I'm a cell biologist, and I look at cells in a lab, and I can grow cells, and I can grow practically any cell in the body. I've done it. And the interesting thing is, if I don't feed cells with protein, actually if I feed cells with calf serum, so meat, they grow and proliferate and are healthy as can be.
Mm-hmm.
If I try to put them on something that is not that, a vegetable-based diet,
Mm-hmm.
they do not grow. They do not proliferate. They are not healthy. Same exact thing as when we've done, for instance, I've worked with bone marrow stem cells before, and I'll look at bone marrow stem cells from a vegetarian versus somebody that eats, a flex diet, whether it's carnivore, whether it's just they're taking in the right nutrients. It's night and day, essentially, in what I see cell wise, what I see with the potential of the stem cells from that individual versus somebody that's a vegetarian.
Yeah, got it. So protein quality, amino acids. I'd love to dial in that. Like you mentioned, protein and when you're talking about longevity, mTOR specifically. Can you define mTOR for people that don't know? And like, what's your view on where mTOR should be when you talk about protein sparing and fasting? And you hear conflicting things out there. Some people say, no, mTOR should be low all the time. And other people are like, no, there's a time and place for it. What's your view on that as it relates to longevity and stem cells specifically?
The problem is it's a difficult balance, because if you look at the science, it sort of goes hand in hand with insulin growth factor, so IGF-1. And if you look at the literature out there tells you that those go hand in hand. And the literature tells you if they're high, you cause excessive cell proliferation. Well, think of what we just spoke about, is essentially what you're doing is prematurely aging somebody for the benefit of them feeling really well, because you do. That's why people take HGH. I mean, it's a no-brainer. That's why they take it, because they feel fantastic. Is it a benefit for then later on down the line, you premature aging? We don't know. We're not at that juncture. If you look at a lot of the caloric restriction, the longevity, all these guys have their IGF and their mTOR lower. And this is what's been proven so far, centenarian studies, basically, they last longer. They live longer, they're 100, they're healthy, and theirs is lower. But if you look at now, what people talk about is, we don't know how well, as far as quality of life surveys and all that, because, how well do they live? How well do they compete? I can tell you right now, my father, I'm 59, I'm going to be 60 soon. My father was 59. There's no way in hell he can, keep up with what I did. I know that for fact, or many people around that at 59, as you know this now. I mean, at my age, mm-hmm. I have no problems. I'm lifting. I'm stronger than I've ever been. Mm-hmm. I'm still running. I'm not running as same as when I was in the military, because it's too rough on the joints, but I'm still running 3 miles with no problem. Mm-hmm. I don't want to run too much because it does impact the joints. And there's so many other things that you can do to keep healthy as far as fitness goes. Mm-hmm. But eating is the key, because people don't understand. With cells in your body, it's the simplest thing that you can do to change your lilife. There is nothing more important than what you put in your mouth.
Mm-hmm. So
in the stem cell front and the cell biology front.
Yeah. So do we want? Is it better from a stem cell standpoint to have mTOR at least cyclically higher for stem cells, or not? I mean, what's the name of the game there, I guess, for you?
We don't know, because we haven't studied specifically that. But I can tell you, for instance, back in 2000, and when we developed the specific stem cells that we have that are in clinical studies for autoimmune diseases here in the United States, we studied various different feeding regimens. And based on the feeding regimen that we found these cells to be significantly younger than others. And believe it or not, that diet for these cells was a keto-based diet. It's a very, very low glucose-based diet.
Yeah.
Low sugar, little bit higher in protein, and a caloric restricted in a petri dish. So you're just thinking of studying in a petri dish where you're measuring glucose levels versus standard formulations that feed cells with a bunch of sugars. This is what science has always taught us, mm-hmm. Through everything. And what we saw was these cells, their telomeres were much longer. And then also the telomerase, which helps protect the telomeres, so the aging of these cells was much higher mm-hmm. with these cells. And it's weird, because when you would look at these cells at first, when you would feed them this, they would sort of look unhealthy. And then, sort of like when people go on a keto diet, mm-hmm. then after a little bit of time, you would see an adjustment, and then they would start proliferating and look really healthy and producing the numbers that you would want of cells for the context of a cell therapy, and then also maintaining really high, telomeres. So the amount of telomere attrition that was happening with each division wasn't as significant as ones that had sugar-based formulas or weren't fed the right regimen.
Got it. So it's fascinating to me because there's different ways to do the ketogenic diet, right? And somebody can be in ketosis certainly on a higher protein diet, but just classically defining the ketogenic diet, it's typically defined as higher fat, moderate protein, lower carb. And that was always the longevity keto research guys. They would always say, well, that moderate protein was important because you could be in ketosis and it would keep mTOR lower, i.e. this sort of perfect environment for longevity. I'm wondering, do you feel like very higher protein diets, let's say someone's not moderating their protein at all, they're just going really high protein, leaner cut meats, but lower carb. If there's diminishing returns there, is there any evidence to show that it's too much of a good thing?
Personally, I haven't seen any. And people, exactly what you said, the stigma with keto is a bunch of fat, et cetera. No, trust me, you and I've done this. I have a Keto Mojo little device. Stop eating for one day and just drink water or just drink bone broth if you want for one full day, and measure tomorrow morning, you're going to wake up in ketosis, and I have basically consumed barely any fat. I haven't consumed anything, hardly any, it's just cutting calories, you're going to go into ketosis.
Got it. Is there any, people hear, okay, you have to get X amount of grams, 90, 100 grams of protein a day. Is there a specific threshold that you like personally to make sure we're supporting our cell health?
I look at each individual as completely different. We're all different. It just depends on what makes you feel good. I know for instance, for fact, I know when I eat high protein, I feel better. I feel fuller. That's my personal preference. Others don't, or others say they can't handle it. It just, for me personally, it is, even though, for instance, our feeding regimen is a 15% protein on cells.
Okay.
And it's where they're optimal.
Got it. Interesting.
But the rest of it is, sorry to interrupt. The rest of it is all amino acid based.
Yeah.
That's eventually going to convert anyway. So
interesting. Okay. So let's talk about stem cell therapy. Are there different types of stem cell therapy? Can you guys talk about the different options that are out there, the sort of advancements in the space?
Yeah. So a lot of times, here in the United States, people are talking, hey, I had stem cell therapy. And I was like, really? Where'd you have that in the United States? Because it's really, technically speaking, not allowed. Oh, no, they say it's approved. Well, I had some extraction from my bone marrow, and and they used my stem cells from there. They call it stem cell therapy. What you're not understanding is, if you're 40 years of age, it's basically 1 in a million stem cells. So there's 1 million other cells in there, and then there's one stem cell. So even if they extracted out, let's say 100 cc's, 2 big tubes of it, of your own bone marrow, you're going to have maybe 40,000 stem cells, maybe there, something like that. It's not that much stem cells. There's a bunch of other factors in there because remember, our system wants to be in homeostasis. It wants to regenerate. It wants to heal. There's factors in there that may work, but it's not the same as what we do. And I'll go into that in just a minute. And then you can do it from your fat. They extract it from fat now as adults, and the frequency of a particular type of stem cell that's in there is a lot more. So it's like one in 100,000, something like that. So there's more of them in there. And then there's also other supportive cells that increase blood flow within fat that they use simultaneously. So that's another one that people talk about, but it's not a true stem cell therapy. A true stem cell therapy essentially is you've isolated a stem cell and then you've grown that stem cell and it makes clones of itself. You've grown it up. And what we go back to most importantly is, how did you grow up that cell? And what is the age of it? And then what are the genetics of it? Because you have to make sure there's no aberrations. You should make sure there's no aberrations, which goes back to basically growing it up, looking at the donors, this type of thing. But it's, the food, what I just talked about. We ran through think it was like 12 different foods or something like that, feeding regimens. And we found the right one. We have a patent on it. This is how we grow these cells. These are the properties of the cells. And what we looked at is the other thing is that you have to look at is, for instance, one stem cell is not going to fit every disease.
Mm-hmm.
So we as cell biologists can take a cell and coerce it to make some changes. For instance, a simple example of this is, and I've done this, I'm from the central nervous system, brain and spinal cord injury sector. And you take a cell and you feed it, for instance, a specific factor on a regular basis. And I'll give you a simple example of it is this thing called brain-derived neurotrophic factor that was considered the brain a fountain of youth many years ago. And there's still being a lot of studies on it too.
Mm-hmm.
But if you fed a cell, a regular cell, this consistently, the machinery within the cell then says, I have this, I have this, I have this. I don't have to produce this. But when you stop doing that, there's a sequence inside the cell. There's a machinery in the cell that the cell then says, wait a second, where is this? I need to possibly try to start producing this.
Mm-hmm.
And it finds a way to produce it on its own. So you would think of this type of cell to be a better cell for neurological disorders.
Mm-hmm.
Versus our focus is on the immune system, because we know that every single disease has an immune component to it.
Inflammatory.
And an inflammatory mediated component to it. And focus on what we know the specific cells that we use can do is, regulate your T cells, increase your regulatory T cell production. They can reduce, tumor necrosis factor alpha, which are all those commercials that we hear at night of the drug of suppressing your tumor necrosis factor alpha that basically causes a crazy amount of side effects when you do this, which it does, when you do this basically not naturally.
Right. Yeah, absolutely. Because inflammation, for people, most people know that listen to the pod, it's a product of the immune system. So stem cells modulate it, right? It's not artificially suppressing it. Is that?
Yeah.
Okay. Got it.
Yeah. So it all it does is just upregulate, bring up the amount of what's called the regulatory T cell.
Tregs, yeah.
Which regulates your system and tells the anti-inflammatory to come up, the anti-inflammatory T cells to come up, and then the pro-inflammatory, inflammatory ones to come down. That's how it modulates the system.
Yeah. So it's like on a seesaw for people that are like imagining this. It's balancing the seesaw stem cells versus like shoving one up and one down.
Yes.
Which has long-term effects oftentimes when we mess with God and nature. Okay. So do you recommend, like, where is stem cell therapy legal? And do you recommend for people that are good candidates to go to these other places to get it done?
It's not legal yet in the United States. We're in, for instance, clinical studies here in the U.S. We have a phase 2/3 going into which we were designated orphan status, fast track status for a particular disease called polymyositis, dermatomyositis, or it's now called idiopathic inflammatory myositis. It's a relatively rare condition in the autoimmune sector, but it's growing as all autoimmune diseases are growing, because what we saw in the phase 1 study was that we can reduce steroid use in half, which is really, really important. That's number one. Number two, the only basic test that they do for this is what's called a total improvement scale, is what we saw that there was a significant reduction in pain for these patients. There was a significant increase in muscle strength in these individuals. So it was important factors that the FDA recognized this thing needs to move forward a lot quicker, and they gave us the status to move forward. We've now embarked on doing a phase 2 for rheumatoid arthritis, which we're going to start probably Q2 of this year also. We're also running, we did which we published a paper on, a previous heart failure study. We did a phase 1 study here in the US. We're going to embark on a phase 2 study sometime in the near future with this, because essentially a lot of this stuff costs a lot of money. Mm-hmm. So in the US, if you think of anything in the US, you think of it, anything that is going to be stuck in your body, IV'd, injected into you, is regulated.
Yeah.
And it's regulated. A lot of people say they overstep their bounds. There are my stem cells. Remember, they're extracting these stem cells from you. They're doing a process, whether it just be a simple spinning, centrifuging, isolating them. There's a process involved in doing that. And what it does is there's a possibility of infection and causing issues with it. And that's where they're looking after your safety. So, that's why there's a thing called phase 1 clinical studies to show that there's a safety profile in place for it. Then you move on to the secondary aspects to make sure that it's manufactured correctly. Stem cell therapy is approved if you have a license in other countries. For instance, in Mexico, there's quite a few clinics. We actually collaborate with one which we gave our license to, that does a fantastic job, that has our technology. It's approved as long as they have the licenses. I believe the Bahamas has places. Dominican Republic has places that have it approved. In the UAE, they're working on now approvals. I was actually down there recently talking to the FDA equivalent down there to basically establish the safety profile first, and after that, they may go ahead and approve them. There's a couple countries which I just found out recently in Europe that are considering doing something similar too, where they show, pass a phase 1 study with a particular product, because all stem cells are different. Mm-hmm. That's what you have to be careful with. With a particular product, then we will give you what's called a pre-market condition approval, that you can treat certain things, but you have to keep going on with studies. You have to show that these studies have some form of efficacy on it. But as long as it's safe, the patient signs an informed consent that says, the risks are minimal, the upside is much greater than the amount of risks that are actually there, then they'll actually approve it. I wouldn't be surprised that somewhere down the line, we may get to that juncture here in the United States. I don't know, especially now with the change. Mm-hmm. They just announced today RFK is actually coming in, as a health minister. So it just depends on, laws, rules, regulations. The first stem cell product ever approved just got approved 2 weeks ago for a specific company, Mesoblast. That got approved only for graft versus host disease, which is really, really small amount of people that have, following a bone marrow transplant, many of them end up getting graft versus host disease, which is a sort of a death sentence if you don't keep it under control.
Got it. So at this point, since it's not legal in the States yet, we'll see. Let's say people get the procedure the therapy done in Mexico or Bahamas or Dubai or something like this. What can they expect? Like, what is it, one and done, and is it multiple sessions, and what's the procedure itself look like for people to describe it verbally?
So it number one, for instance, I've talked to many patients and describe what we talked about earlier is let's get you healthy and get you prepped for a cell therapy, because exactly what we just talked about a little bit ago. It's easier if you start off with a clean slate,
right?
Let's say a cleaner slate, because you have these individuals that have autoimmune diseases and it's a problem. But let's get you at least somewhat healthier to put it in. Are you a candidate for it? Are you not a candidate for it? Looking at details of the patients. For those that go out there and look for stem cell therapy, and let's say a simple example, I've had this before. Somebody calls you, they have chronic obstructive pulmonary disease, and they continue to smoke. Well, you haven't removed the stimulus that caused the original problem, and you're setting up the whole thing for failure. They're not going to, the ideal place is going to tell you, I don't want your money because you're wasting your time. Mm-hmm. If somebody's going to take your money and doing that, they're just basically setting you up for failure. That's one. Two, in our clinical studies, what we saw, and it was somewhat variant depending on, for instance, in ulcerative colitis, we've done what's called compassionate use investigation on new drug applications, where we get approval for the FDA to do a couple cases. And what we saw is that it requires more than one therapy. It's a therapy. Mm-hmm. So, and it required it, actually, what we've seen in the intervals of every 3 months, it's worked really well. Where so far we actually have a case that's possibly in remission. We're going long-term out now, what we're seeing. So we did several of them, possibly in remission. We've had other ones too that have significantly improved their quality of life. We've had ones that have been on biologics with this therapy, and then we taper the biologic off. It's got to be done smartly, and they actually remove it. We have a couple people actually in polymyositis, dermatomyositis. Actually, our funder of that study is in full remission of disease. She's been in remission of disease for 2 years now. This is an individual that's taking steroids daily and taking a strong immunosuppressant daily, setting herself up for cancer somewhere down the line. You need your immune system. There's got to be a balance. Otherwise, you will get cancer.
Got it. So a typical session, you mentioned a series, it's a therapy. Is it an hour? Are they if you set the scene of like, are they hooked up to an IV? Is there any pain involved? Like what's the experience like?
So standardly is wherever you go, wherever you reach out to, if they're not requiring a significant amount of blood labs up front and understanding, I would stay far away.
Okay.
They need to understand, evaluate your case.
Yeah.
Understand even allergies, simple stuff, because cells are frozen in dimethyl sulfoxide. So if you have an allergy towards an antibiotic, you are going to have an allergy towards this. They have to be prepared. Otherwise, they put a risk on you. For this, understanding everything correctly before you decide to go down. Normally, the days that you go down, they'll normally do a simple blood lab to make sure everything's okay, relatively healthy again. And it's normally, for instance, the center that I know that we work with does a 2-day procedure. It depends on the individual. If it's for autoimmune diseases, they do a 2-day procedure where they'll infuse in 100 million cells one day, and then the following day, they'll infuse 100 million cells. And the concept is a little bit different because depending on what meds you're on, if you're not on any meds, then the smart approach is what's being done is let's suppress your immune system a little bit by giving you a small dose of a steroid and then give you specific antihistamines to basically stop any form of allergic reaction or any overactive immune system, killing everything. So these cells have the opportunity to stay in your body longer because everybody thinks you put, and we're going to go through that, which is interesting. Everybody thinks that you put a stem cell in you. Remember, you stuck an IV in you. Now it's going to go into your entire body, and I'm going to regenerate everywhere I need. That's not the case.
Wouldn't that be nice? Wouldn't that be nice?
That would be fantastic. But what realistically happens is the cells, you'll get an IV, and then first and foremost, the first stop is the lungs. And cells are relatively large in size. It just depends. I know the ones that we use are about 11 microns in size. They're relatively small and younger cells. It's crazy how for those that don't know, we talk about as we age, you normally gain weight a lot more when you age. Your cells as you age get larger. As they age and they multiply, the older somebody is, you can look at the microscope and you can see the larger the cell actually becomes many times, which is pretty crazy. But anyway, they go into the lungs is the first stop. And then they sit there because it's hard for them to get out of the lungs. They have to go through the microvasculature, which the only way they do that is by a process called extravasation, where they will smash and go. And then the next stop is the liver and the spleen. So if you look at the animal studies where we actually took cells, stem cells, and put them we labeled them with a color, and we put them into a vein, and then they reside in the lung first and foremost. And then after 3 days, they start to extravate, go out. Not all of them, several of them. Many of them start to go out, and then they will actually go, believe it or not, to the gonads, to it seems to appear possibly the bone marrow, and then they circulate back up, maybe 3-5% of them, to the brain. So there's only a small amount of them. But what people don't understand is as they're in the lung, remember, there's a circulatory system that's trying to keep in homeostasis, and it can register issues and imbalances. That area right there, every cell, just like you do on a daily basis, strives to survive. The cells that are in the lung spend time striving to survive. How do they do so is what we talked about earlier. The machinery that has registered what is needed in the body, it starts producing that and starts producing it out so that the neighboring cells, the ones that were put in, and your lungs and the vasculature can try to become homeostatic where they basically can try to survive. At some juncture, so all these factors are really tiny. Those go through the circulatory system. Those are called exosomes. Those are nanoparticles that have a lipid bilayer just like a cell, and they will go and try to find an issue and fix it. But based on what the cells have gone in there is what they will produce. At some juncture, the cells will start to die because they're not in the right nutrient environment that they were in. The neat thing that happens is the predominant cell in the lung, it's called the macrophage. And it's the one that basically keeps you from getting unhealthy, having a cough, having a cold, all this, getting sick on a regular basis. And it's a macrophage because it picks up, bites, gobbles, and eats things, it picks up these cells. And it's normally a pro-inflammatory cell, what the scientists call an M1 macrophage. It's a pro-inflammatory cell that has to fight, remove, and target. It actually, once it picks up the old stem cell, the one that has died, that's no longer there, it changes its physical feature, its phenotype, actually to an anti-inflammatory healing one. So it becomes an M2 macrophage that now is your own cell. That's your cell that is now releasing in the lungs, within the lungs, those anti-inflammatory healing cues.
Wow.
Also, so it's a primary effect from the stem cells. It's a secondary effect from your own body making a change.
That's powerful. So you mentioned rheumatoid arthritis, you mentioned ulcerative colitis, and then these more rare conditions. Are there any other inflammatory and or autoimmune problems that you feel is promising when it comes to these stem cell therapies?
We've done a couple cases that it's funny because normally a lot of times when you have an individual that has one autoimmune disease, some of these autoimmune diseases cross over. For instance, ankylosing spondylitis. That's another one that we've looked at where we've actually resolved issues with somebody that had ulcerative colitis and ankylosing spondylitis. We've looked at that too. We have not dug into lupus yet because there's so many studies out there already in the lupus sector that are doing it. What are some of the other ones that we?
How about MS? I'm curious on MS. Any study?
That was the one that I actually was going to talk to you next. Okay. It depends on what type of MS.
Okay.
We've worked with some that were primary progressive and have had some good results. In the context of that, it's a little bit different because we look at a twofold approach. One is dealing with the system, and then how do you deal with the lesions in the brain and in the spinal cord is you have to tap the central nervous system. And the way you can do that is to what's called an intrathecal injection, similar to what people know as a lumbar injection, a lumbar puncture. Because within our spine and our brain, we have a fluid-based system that's called the cerebral spinal fluid. And we have ventricles where some of this stuff is housed, produced on a regular basis. And it's a nutrient-based system. So when you have the lining of right where the spinal cord is and the brain, there's a lining, it's the meninges. And that lining encases this cushioning and this protein-based system. You can actually penetrate into there, which is what's done. And then you can actually put some stem cells in there. And it's a circulatory system. It circulates and turns over on a regular basis. So you now have the opportunity of this to get throughout the entire spinal cord and actually go into the ventricles of the brain also, that they can have a positive impact within those areas too.
Got it.
It's a little bit different of approach.
Yeah, interesting. Okay, so not autoimmune per se, right? It may have autoimmune components, people could argue, but cancer, I know that's probably, has there been any studies done on stem cell therapy and different types of cancers?
We personally, so there's, let's take a step back. There's different types of stem cells. One of the stem cells is a blood stem cell. It's called the hemopoietic stem cell. It's the mother stem cell. It's why when you have a baby, many times they'll ask you, do you want to store your cord blood? And the purpose of that is for one thing, is because there's a hemopoietic, a blood stem cell in there that can change into any immune cell type. If, God forbid, something happens to your baby, they have a hematological blood disorder, a cancer, you now have something banked that they can actually do. They have to do a chemotherapy because they have to remove that bad cancer from them. And they can now use this to rebuild your baby's immune system, to get a healthy immune system. So that's a different type of stem cell, similar to what you hear as a bone marrow transplant.
Right.
Somebody has cancer, they have leukemia, they get a bone marrow transplant from somebody else that has to be a match to do so. Plus they have to be on immunosuppressive drugs the rest of their life because of that. But that's a different type of stem cell. The stem cell that we use, which is it's similar to what's called the mesenchymal stem cell. We believe ours is superior. They're called umbilical cord lining stem cells because they have much younger profile than a standard mesenchymal stem cell. That cell you would not use in the context of cancer. There's no evidence to use this in the context of cancer. The reason being is because one of the factors that is very well known that it releases is vascular endothelial growth factor. That growth factor helps increase blood flow. And if you look at cancers, and especially tumor-based cancers, and if you pull the tumor out of a body, you will see a significant amount of vasculature in there. It's not necessarily per se the cancer eventually kills you, but secondary to that is as you're consuming nutrients, especially when you're consuming a lot of sugar and you have cancer, is that thing is so vascularized that it's consuming all the nutrients that is needed in your body. And that's why cancer people lose a ton of weight. It's because the tumors are consuming everything.
Yeah.
At that juncture.
Got it. Okay. Again, not another autoimmune condition per se. It's not classified as that, but some studies I've seen say it has an autoimmune component, possibly, is Alzheimer's. Anything promising with Alzheimer's and stem cell therapy?
We believe so because, yes, there is an immune component. There's an immune component to everything, to that, to Parkinson's, all of it. We believe so. I think if we catch it early on, then yes, because one of the issues with Alzheimer's is now known that the blood flow, and we just talked about the blood flow, the lack of blood flow. Actually, as you age, your vessels start to constrict and you have a lack of blood flow to the brain. So what happens there is a lack of the right nutrients, lack of the right oxygenation causes all these issues. The immune system also, unfortunately, as you age, has the ability to now penetrate into the brain and the spinal cord where in the ideal situation, it's not supposed to. And that causes further damage. So if you can suppress the inflammatory response in the system, in theory, it should work. There's a couple of companies, I believe, that are embarking on studies of such in Alzheimer's. There's a possibility that it may slow down the progression of it, but we personally haven't seen anything or studied anything like that yet.
Yeah. Well, I mean, what you have seen with autoimmunity, which is my main telehealth patient base, it's so exciting. That's why I wanted you on the pod. But these other conditions, I know people that listen to the podcast want to know about as well. So it's all very exciting. How about somebody that's just, all right, they don't have a chronic health problem, but they just like the fact that they want to be supporting longevity and lowering inflammation just because they know we live in this sort of toxic soup of a environment. What's your thoughts on that, just preventatively?
Absolutely. We actually just had a conference on that just recently. I published a paper actually in 2015 on the concept of it, because as you age, the amount of what's called tumor necrosis factor alpha, which is one of the key leaders of pro-inflammation, being in a chronic inflammatory state. The other one is CRP. The other one is IL-6, interleukin-6, are the key. And those three are directly correlated with age-associated diseases and aging in general. The term that's called inflammaging, which I talk about in this paper too, that was coined in 2006. If you can control those three, and you can. So as you age, and as you're, there's, I mean, the conditions out there now, the food, everything forces an inflammatory response. The viral burdens that are happening force an inflammatory response. It's crazy. I'm seeing, and you're probably seeing the same thing now. A lot of people come and they're sick. For instance, this long haulers, this chronic fatigue syndrome. It's crazy how you look at these individuals and they are somewhat in a chronic inflammatory state. But if you look at what's the underlying problem is they have a crazy amount of high viral titers. So how are they chronically inflamed and have somewhat of an immune system, but the immune system's not mounting the correct response to the virus? There's just so many different weird things that are happening out there now with so many different people.
Yeah.
And it's because I think of all the obstacles that are given to us on a daily basis.
Yeah. So you have seen good success with long haulers, like POTS dysautonomia, that's triggered by COVID or another virus or another stressor?
We have, so long as we dig deep down into looking at the blood labs of what's transpiring.
Yeah.
Because is it completely virally mediated? I've seen individuals that have just a pure healing response and they have no immune response. And, and you can test for these type of things by looking at, TGF beta, for instance, is a test that you actually look for.
Yeah.
All these individuals, based on symptoms, I can tell them, let's test this. And if it's high, I know we have a true healing response. We now have to shift the tide and try to find a way to remove virus, which is a different platform that we work on, which is natural killer cells, because that's what these inherently do, is eliminate viruses and eliminate senescent cells.
Yeah.
In the body.
Yeah. I love that you run TGF beta 1 too. Not many people talk about it. I love that biomarker for these pro-inflammatory cases. And they're high. It's out of range in most of these autoimmune long hauler COVID, POTS, mold toxins. I see it high a lot as well.
Yeah, I always look at EBV too.
Yeah.
Because it's sort of nobody talks about it, but
Yeah, for
it's
sure.
one of the biggest issues. It's probably the issue of why you got possibility of.
For sure.
That's my theory, is of why you got your autoimmune disease to begin with.
And I will say this. Tell me if there has been studies on this in your world, I would love it done. Is these HLA, human leukocyte antigen haplotypes, like almost 100% of our telehealth patients have these gene variants that are associated with sensitivity to these viruses and mold and bacteria. Is there any, like, what are your thoughts on that? The genetic susceptibility, I guess, to these issues.
Correct. Which those the majority of them that I've asked to test are exactly what you said. They're positive.
Yeah.
And they're the ones that are the worst.
Yeah.
The worst off of it, and they're not mounting the correct immune response or the balanced immune response, and they're having a bunch of havoc. We haven't done anything in the context of putting stem cells in and looking at that. It's something interesting that we're actually interested in looking at too, is what transpires. We're talking now about possibly, because we did a phase 1/2A in COVID. We were considered the Hail Mary many years ago. There's a couple stories on us online about it. We were like the Hail Mary of individuals, tried everything, the steroids, the anti-IL-6 that was available then, all these different things that were available back then. And then they got intubated, and then we were the Hail Mary.
Wow.
Yeah, we were the Hail Mary on many of them. And we saw some good results. What we established was a complete safety profile. We saw some good results. Many people survived that shouldn't have survived. But the commonality we saw with death following that was individuals morbidly obese and other comorbidities that they had, diabetes and a bunch of dysregulated things.
Got it. So at this point, is there a directory of clinics that you recommend? Is there any way for people to find out, okay, I have this issue, or I'm interested in longevity and, being the best version of myself? Where do people go to learn more about the clinics that you think would be that are reputable?
The ones that I directly work with ReHealth, 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 and they're in Cabo and Cancun. There are other clinics out there that I know do good work. For instance, a place in Panama does good work. Also too, those are probably the only two that I can say that I would trust.
Okay.
And I would say, yes, go ahead and go. There's individuals that say, hey, I want to go go knock yourself out.
Okay.
I know that they do good work there. It's not that they do bad work there.
Mm-hmm.
So it's I would just stick to, we are very science focused. We are very, let's figure out what's the problem. Same thing you do.
Yeah.
What is the problem? How do we try to fix the problem? And then sort of prep the body beforehand. That's why we work with the likes of, Dan Pompa, Josh Axe, many individuals like you.
Mm-hmm.
that help us get individuals ready for this, because essentially it's not cheap and you're investing in your health.
Mm-hmm.
These are not cheap therapies, but essentially you have to look at, you're investing in your health, you're investing in longevity, and when you're doing this.
Yeah. What is the cost range for people that are wondering?
It normally runs in the range of about anywhere from $23,000 to about $28,000-$30,000. It just depends on what's being done. The majority of people the majority of people that are over 40 that go down there always go with the mentality of, I'm fixing one thing, but simultaneously they all have a shoulder problem, a knee problem, a spine problem. So they'll go do a bunch of different orthopedic things too simultaneously with it.
Yeah.
So it just depends on what's being done, what's the protocol, what's the procedure for it.
Got it. So now with Bobby Kennedy as Secretary of HHS, he's talked openly about therapies like stem cell therapies and exosomes and other things that have been historically maybe put on the back burner or subjugated, and the preference is normally pharmaceutical drugs. Are you hopeful that your space is going to get more attention and more fast tracks?
We have a significant amount of attention. I think what needs to happen already, especially the stem cell sector, there has to be some regulation in the context of people just selling whatever and saying they're stem cells.
Yeah.
And I hear nonsense all the time of, hey, I had a vial of this and it has this, and I think of, I just recently somebody posted, hey, in some place in Florida, hey, I had a vial of these stem cells in there and it had I don't know how many billions of stem cells in there. And as a scientist, I think, This is ridiculous because biologically, in a vial like that size, you can only put maximum 30 million cells to have any form of viability of anything. And if you had 1 billion cells, the cost of 1 billion cells would be hundreds of thousands of dollars.
Yeah.
This kind of thing. So some of the stuff is just nonsense. That stuff has to be cut out. I hope they stick with, in the ideal situation, exactly what I talked about earlier is check safety profiles on specific products, whether they have to run a small scale study on it, and then, have some kind of a conditional approval on it, that you can do some limited marketing on it or something like that. That would be the ideal situation. Loosen it up a little bit with that. But ultimately, looking after the safety of individuals is important.
Yeah,
because some of these sales guys are just sell you whatever to make a dollar and tell you it heals all, it cures all. If somebody tells you it heals all, it cures all, that's a red flag right there.
Yeah.
Because it's not a cure, it's a therapy.
Right.
It's definitely a therapy.
Right. It's a supportive therapy. Got it. You mentioned exosomes earlier. I wanted to touch on that before we go. Like you mentioned it on being made endogenously as part of the process, the healing process. Then people hear about exosome therapy and stem cell therapy. What's the difference between the two?
Great question. So the exosome is a communication signal, bioactive molecule from one cell to another. When somebody produces what we just talked about, remember when I told you that you put a stem cell into your body and it houses in the lung, the stem cell has to become a machinery and produce exosomes based on what's going on in that body.
Mm-hmm.
It's going to produce a lot more exosomes, and it's going to basically be tailor-made to the issue that's happening in the body. When an exosome is pre-made, it's predetermined. It's sort of like a simple analogy I talk about is you have a headache and I give you a Tylenol, and the Tylenol doesn't take that headache away. That can possibly be an exosome can work, but it might not work. It's like the Tylenol may work, it may not work. But if I gave you a super modified Tylenol that can morph to the problem that's there, that is your stem cell.
Mm-hmm.
It's a different animal. It's a much higher level of it. We can produce, the good thing about exosomes is that the cost goes down significantly because we can produce bucket loads of this stuff. It's essentially sort of a recycled product from a cell.
Mm.
You grow up, think of a petri dish, and you fed it a food, and then you're recycling that food. You capture those signals on top. The cells are still there, and you capture the top portion. Depends on what type of condition you're on is what you're capturing.
Mm-hmm.
And then you can isolate the exosome. Nobody really has a true pure exosome product, very similar to what we talk about with bone marrow. In science, what it's really called is what we call it is a secretome. It's what a cell secretes out. So cells not only produce exosomes, but remember, the cell's in charge of producing the extracellular matrix that we live in, the hyaluronic acid, the collagen. I mean, we're predominantly collagen-based human beings.
Mm-hmm.
And it's the most abundant protein in the body, and the importance of it. But this is released directly out of cells, not more normally via exosomes, because it builds a 3D matrix that we actually live in. So that's a secretome-based product. That's what majority of that's out there now are secretome, not pure.
Got it.
To isolate a pure exosome, you have to basically, there's 3 individual markers that you isolate those out specifically, and the production of it is, relatively low.
Got it.
When you do that.
Something came to mind like years ago. You'd hear it on the news. Controversies around stem cells as it relates to fetal stem cells, and there was a lot of pushback of like stopping research on that. But now you don't hear about it at all. Like it's not within the space. Is that still within the space? Is there still controversy when it comes to fetal stem cells?
There is a lot of controversy behind both fetal stem cells and embryonic stem cells still to date. It just depends on the individuals. It depends on the state. It depends on, but what a lot of people don't understand is, many times, unfortunately, science has to use these modalities to do studies, to progress. There's the individual that'll tell you, I'm 100% completely against fetal stem cells, yet, wait a second, you took a vaccine, and that vaccine was developed with a fetal stem cell
Mm-hmm.
in it. So you haven't thought about that in the full context of all the science that's been developed with many of these modalities.
Mm-hmm.
But it is frowned upon a lot and is being avoided as much as possible. As far as I know in the sector, is being avoided. I know companies that have actually, basically closed down, have stopped doing a lot of the research. But there's still a lot of embryonic cell researchers, still quite a bit of it out there. And there's also another new technology. It's relative. I mean, it's not that new anymore, but they consider it relatively new, which is called an inducible pluripotent stem cell. And that's essentially when they can do it in many different ways. They take a cell from you and they sort of reverse engineer it or bring it to de-differentiate it to an embryonic state. And then, so they sort of make an embryo of you, if you think about it. They bring it back in time, bring an embryo. And then from that side, they can then produce any cell in the body from there. But the only problem with that is that it's still going to contain the genetic inheritance of you in it, which that they already know. But they're used fantastically well with disease models. You can now truly study a disease with this type of technology.
Mm-hmm. Fascinating. Have you heard of V cells before? Very small embryonic like stem cells, and if so, what are your thoughts on that?
Yes, I have. There's a lot of controversy behind them. Many people say that they don't exist. There's some publications say that they do exist. There's some scientific publications that show that they don't exist. If they did exist, there would be very, very small amounts of them.
Got it.
And if you thought that they were beneficial in your own body, it's a difficult thing, because a simple example of such is there's a drug called Neupogen. And Neupogen is designed to stimulate your bone marrow to produce out a lot of progenitors and more stem cells in your body so they can be collected for cancer therapies and put back in to somebody that needs it. They did a study in heart failure patients. Is number one. Heart failure patients that have heart issues, have more circulating stem cells in their body than others, healthy individuals do.
Mm-hmm.
And if you think of why, it's because the body is inherently trying to heal itself. The problem is that there's a lack of the cues and the guidance to stimulate that stem cell to do what it needs to do. So when they use this Neupogen, they tried this. They said, okay, let's put a lot more stem cells in the system on a heart study. It did not work at all.
Got it.
It did not work. It's not a thing of producing more stem cells. It's a thing of having the correct guidance cues and the correct signaling to activate the stem cell to do what it needs to do.
Yeah, got it. Makes sense to me. My friend, this has been a blessing of a conversation. Thank you. Before we go, the end of every episode, we have your art of being well. So I'm excited to pick your brain about a few things. First question that comes to mind is, do you take supplements? And if so, what are two that are maybe out of the box, more uncommon things that more people should know about?
I do. I take a lot of supplements, better than taking any pharmaceuticals. I take no pharmaceuticals and I'm completely healthy. The ones that I go back to, there's one in particular that I love. It's called arterial cell, and it actually helps.
I love arterial cell.
Perfect.
We use it, but explain it. I've never talked about it in the pod before.
So my mom, I have her on it. It's essentially what it's designed to do is to help the lining of the vasculature. So if you think of it, it sort of makes it more permeable, because as you get older, what we just talked about, the vasculature becomes more restricted. It becomes hardened, which is arterial disease.
Yeah.
And this loosens it up. And what it's done significantly, and what I've seen, and it's a supplement, complete natural supplement. What I've seen is it helps regulate blood pressure.
Mm-hmm.
And I've seen it do it. I've seen it with my family members, seen it with myself. I've never been really high, but now I'm like, people are like, you're 50 now, you're not taking anything? No, I'm not taking anything.
Yeah.
You got a consistent blood pressure that's that of, of a 30-year-old. That's one. And two is, everybody knows about it, but N-acetylcysteine.
Mm-hmm. It's a great one.
And the reason why is because we were all having a ton of metabolic issues.
Mm-hmm.
And as we age, and I studied this in the central nervous system in the brain, because you have a significant decrease of glutathione that happens. And it's mostly produced in the liver, and it's also produced in the brain. And it's what picks up all the oxidative stress that you deal with on a daily basis. If you overdose on Tylenol or an ibuprofen, you go to the hospital and you overdose on any of this stuff, or you feel sick, they infuse this stuff into you to remove all the free radical formations that are being produced.
Mm-hmm.
So it's an easy method to do it. It's dirt cheap.
Got it.
Those are probably the two ones that I strongly believe.
I love it. Those are perfect answers. The arterial cell, we use all those with telehealth patients that have cardiometabolic issues, and we see great success too. Artericell and Vascanox is the other one within that same lab.
Which is a nitric oxide, which actually increases nitric oxide. That's another important thing. I take a different product. It's called NO from my good friend Nathan Bryan. It's a lozenger, and you can test your nitric oxide. People don't understand. People that are using mouthwash on a daily basis, you're wiping out your nitric oxide production. You need that to increase blood flow in your body. Don't do it. There's so many things that you shouldn't be doing. These are simple things that you can do. You know, it's great supplements.
Yeah,
yes.
Yeah. Do you do anything like biohacks, any other like tech stuff within wellness?
Yeah, I do. I do infrared sauna. I do cold plunge, not as frequent, but I do infrared sauna, and I also do red light.
Got it.
I'm big and bullish on both of those things because I notice it with me whenever I have any twerks from working out, whatever. I feel a lot better. I love grounding. I have a grounding mat. You know, that's fantastic. It's not only my go-to, but it's my wife's go-to. My kids, 17, 18-year-old that are, in sports, it's their go-to whenever I feel a little sore, whatever. They love it too. So those are the things that I love.
Got it. Do you have any books? I'm getting this running list for the Art of Being Well book club. It could be fiction, nonfiction. It doesn't matter. It doesn't have to be health. But anything that was paradigm shifting for you, read-wise?
There's a There's a book called Breathe.
I've heard of it before and not read it. So tell me about it.
It's so interesting because so many people have an issue of snoring and have breathing issues. And people will tell you I have a deviated septum, I have this, I have that. But it's an interesting book where this gentleman spends his time basically experimenting on himself and a couple others. And the way he does so is, step one is plugs his nose and does straight mouth breathing, and the guy gets sick as sick can be. Then the opposite, tapes his mouth and focuses strictly on breathing through the nose, and all the congestion goes away, all the sleeping issues go away, and he feels much better. He does all these blood labs on it, and it's so interesting because it's proven already that if you spend time focusing on nose breathing, you increase what we just talked about, nitric oxide production within the body too, and that increases blood flow, which is what you need.
Yeah.
So it's a really, really interesting book.
I need to read it. I've been hearing about it, but we have seen great success with patients, telehealth patients, getting their REM and deep sleep up whenever we do give them mouth tape, and they're consistent with it. Do you do mouth tape yourself since reading that book?
Yes,
cool.
I do.
Cool.
I do. It's what turned me onto it.
Awesome. I love it. Man, this has been great. Where do people go to learn more about your work? Like anything, send them to where you go.
You can actually go to my US website is www.restem.com. We're also always posting, like, for instance, we're going to be starting some of these autoimmune. You have a big autoimmune patient population. Some of these autoimmune studies, these are fully funded by our company that will be doing these studies once we start recruiting in the studies. They're mostly, one of them is actually VA-based, Veterans Administration based in Florida. But it doesn't matter. What people don't understand is when you go into these studies, even if they're in Florida, they will pay for travel. If you qualify to go on the study, they'll pay for travel to go to it. The other one's going to be a University of Florida based study too. We're now doing a muscular dystrophy one with, it's called facial scapulohumeral muscular dystrophy. It's an adult muscular dystrophy that'll be done in Stanford in California. Study. So, take a look at the website. You'll see some of the studies that we're actually doing. And if you're interested, just reach out. You can reach out directly to our company.
Dr. Gonzalez, thanks for coming on.
Thank you, Dr. Cole.